So hi, I'm Dr. Trevor Hart. I'm in the Department of Psychology at Ryerson University, and I'm director of the HIV Prevention Lab. I started becoming interested in HIV. I'm a clinical psychologist by trade, and I was working at a center for gay, lesbian, bisexual, and transgender youth. And I noticed that a lot of people were living with HIV, but were having a lot of trouble talking about it, and were really concerned about HIV stigma, and also that a lot of people were afraid of talking about condoms and just asserting condom use, that they felt awkward or that people would judge them. And that really struck me as something very interesting. And I had previously worked in an anxiety disorders treatment lab. So I was very familiar with anxiety, and especially social anxiety, which is anxiety about being evaluated in social or performance situations. And I began to think, this sounds a little bit like social anxiety, that a lot of people had legitimate concerns about being judged by others when they're interacting with people, as HIV positive people, being concerned about being stigmatized, or as HIV negative people, being just concerned about the awkwardness and embarrassment of insisting on safer sex when your partner isn't bringing it up. And so that kind of got me started on some of my research, examining, what's going on in people's heads, and how can we support people both from a mental health perspective and a sexual health perspective so that they can live a long life and a healthy life, whether they're people who are living with HIV or HIV negative people. The work that I tend to do is working with people individually and in small groups. And although we need to continue the fight for social change, and we don't just want to provide counseling to people, that's not the end-all be-all. We do believe that there are people who are vulnerable, and we want to support those people so they can be more sexually and psychologically empowered. One of our studies is GPS, or Gay Pause Sex, and that is a program that we're trying to evaluate that is to promote sexual health among HIV-positive gay and bisexual men. And it is a 7-session counseling intervention, and the goal is to help HIV-positive gay and bisexual men to identify what do they want to promote their sexual health and a positive sense of sexuality, and then to help them to achieve their goals. And it's in a very client-centered approach, meaning we don't tell them what they're supposed to be doing. We actually ask them what they would like to accomplish and help them to accomplish their goals. So far, so good. We're just at a preliminary stages. We're just starting up a lot of the research. But it looks like so far that the program is associated with a 40% reduction in unprotected sex with HIV negative or unknown HIV status partners. And what we're also seeing very importantly is that people are saying that they have a better sense of connectedness with their sexuality, that they're feeling more supported, they know it's available in the community more, and they like to have the chance to really talk about them and to talk about their sexuality as a gay or bisexual HIV positive man, and to view it from a really positive perspective and to accomplish their goals so that they can enjoy that part of their life. So I'm working on 2 other studies that are funded by CITAR, the Canadian Institutes of Health Research. And the first one is examining what are the factors that promote resilience, that protect against HIV among HIV-negative gay and bisexual men. So what things socially, what things psychologically help people to stay safe and to promote their sexual health. And we'll be following people up over time. We also have another study that we're just starting up that will develop an HIV prevention intervention for HIV-negative gay and bisexual men who are younger men between the ages of 18 and 25. And our goal there is to help to develop an empowering sexual health promotion intervention. Well, the OHTN currently has been very generous in supporting me with a Career Scientist Award. and it's for my program of research in HIV prevention with men who have sex with men. And I've also worked with the Universities Without Walls Center and also with the Center for REACH, where I work on the interventions program of research. And part of my goal in the interventions program of research is to help the OHTN and the Center for REACH to promote research-supported HIV prevention and sexual health promotion interventions for men who have sex with men and other populations who are either living with HIV or at risk for HIV.